So what we'll do now is we'll move on to our next speaker, who is Dr. Aisling Quiery. So she is a GP working with the homeless population in Edinburgh, and her interests lie in addiction, ACEs, childhood trauma and health inequalities. As I mentioned, Aisling had the opportunity to go on retreat to Peru, using the indigenous psychedelics there that have been used for many, many thousands of years by the healers there. And she's going to talk today about her some of her own experiences and maybe the experience of others who've used psychedelics as a healing modality and what we might learn from that. So once again, please feel free to type in some questions as you go along, or at the end we're going to have plenty of time for a bit of discussion and questions and things at the end too. So I will pass you over to Aisling now.
Thank you very much, Pamela, and thank you very much for inviting me to speak. It's a real honour to speak to you today. So I thought we would do something a little bit different. I don't have any slides, so I'm going to talk to you directly about my own experiences with psychedelics and about how this has informed my practice as a GP. So my name is Aisling Quiery, and I'm from Bangor in County Down, and I currently live in Edinburgh, and I'm actually due to move back home to Northern Ireland next week after 24 years of living away. So I'm feeling excited and a little bit nervous about that. I work with the homeless population in Edinburgh, and prior to that I worked in a very deprived area of Edinburgh as a GP, and I ran a clinic for injecting heroin users. So it was actually through one of my patients that I first heard about the therapeutic use of psychedelics. And I remember him saying to me, "Doctor, you really ought to look into this, because a lot of us heroin users are using psychedelics as a method of healing." So I became interested, and that led me to my first psychedelic retreat. And then, as Pamela has mentioned, I had the absolute honour and joy and real privilege to travel to the Amazon, to a centre called the Temple of the Way of Light, which is an Amazonian healing centre in the middle of the jungle, to work with the traditional indigenous medicos, the doctors of the Shipibo tribe, on a 2-week-long retreat. With 22 other participants, most of whom were doctors, psychiatrists and psychologists from all around the world. And we worked with the Shipibo healers in the evening, and then during the daytime we had support for our personal development and integration of the experiences with Dr. Gabor Mate and his team. So it was a really wonderful experience. So what I thought I would do is talk through some of my own actual experiences in what we call ceremonies, in ayahuasca ceremonies, and how I feel these highlight the particular techniques or particular things that psychedelics have to offer over other modalities. And I really want to say that I have also used yoga and meditation and body work and journaling and exercise and breath work and all sorts of things that I have found along the way that have been really helpful. Psychedelics is just one of these things, and it's not for everybody. And in some ways it opens a window of possibility, but it's still important that I believe that we have to do a lot of work in between. So it's not, as we've already discussed, it's not like a pharmaceutical drug where you take it and then you're changed and then you can just sit back and get on with your life. So ayahuasca, this has already been mentioned, the active ingredient is DMT. And it's been used for many thousands of years by the indigenous people of the jungle in the Amazon. It's from a vine, which looks like a very thick piece of wood, and it's made into a tea, into a brew, and it's drunk in a ceremonial setting with the support of healers. And one of the most important things, which I think differentiates the DMT experiences that Pauline was mentioning about the young people taking it, and I noticed she mentioned in a woodland, which I think is a great setting to take DMT. But I think one of the big differences in the ceremonial setting is it's very much in a ceremony where there's a lot of work done on setting an intention. And this might be something like, show me my fear, show me my anxiety, show me something or teach me about something that I'm having difficulty with in my life. So there's a lot of work that's done prior to going into the ceremony, so that you can really look at one particular area in your life, and then there's a lot of support that's done after the ceremony to help you to make sense of your experience and to integrate it. And of course, we were extremely lucky in that we had Gabor Mate to guide us through that as well, who I'm sure most of you know. So a little bit about myself. Before I came to psychedelics, from the outside, I appeared to be a very successful and happy person, I guess. I was a GP in a successful practice. I had lots of friends. I had a nice flat in Edinburgh. I lived on my own. But I felt quite unhappy in my life, actually. I would describe myself as feeling a bit stuck, not quite sure where my career was going, not quite sure whether I wanted to stay in Edinburgh or not. I would get quite a lot of anxiety, and I certainly would have described myself as a worrier. I would lie in bed at night and ruminate and worry about patients. I found my job quite stressful. I struggled with insomnia. And I'd always felt that I was quite alone in the world, and I felt that I was unable to really be in touch with my emotions. And I think my friends would have described me as someone who could be quite angry at times, and also someone who never cried, never showed emotions, and was certainly someone that you would never go to discuss personal issues, which is ironic since I've worked as a GP. So I wasn't quite sure. I was aware that I had these kind of struggles in my life, but I wasn't really sure why, because I looked back on my childhood and thought, well, my childhood seemed perfectly happy to me. So I was a little bit stuck, and that's how. And I also found it very, very difficult to ask for help. And I think this is something that's actually quite common in our culture, and is certainly very common amongst doctors, that we see ourselves as the helpers, but we have a lot of shame actually around asking for help for ourselves. So the first ceremony that I attended, I started off with this feeling of nausea and palpitations and tightness in my chest. And these are symptoms that I've experienced throughout my life, especially when I'm feeling stressed or under pressure. And this is one of the things that psychedelics does so well, is it actually amplifies anything that's going on in the body. So any areas of tension or physical discomfort or emotional difficulties, psychedelics really amplify this. And this is something that I find interesting, because what the Shipibo healers will say is that if we have any difficulty in our life, we want to bring those to the surface. So they like ayahuasca for this reason, in that it really brings to the surface and makes much stronger any physical symptoms that we have. And this, of course, is the complete opposite of the medical model, where if a patient comes to me with pain, I immediately try to make the pain go away. What I learned from the Shipibo was that symptoms are not problems to be gotten rid of, but they're actually really interesting and informative data that tell us something about what's going on in our lives, and can give us clues about where we are struggling in our lives. So I sat in the ceremony with very, very strong palpitations and real feeling of sickness in my chest, thinking, this is familiar, where is this from? I don't understand it. It was extremely uncomfortable, and I really just wanted it to stop. And then what happened was I somehow understood that this stuckness that I'd been feeling in my life, and this anxiety that I was feeling in my chest, was somehow stuck emotions. And what happened then was I had a huge emotional release. I started crying, and I cried and cried and cried and cried really for most of the rest of the ceremony, in a way that I'd never cried before. I remember I had a lot of snot coming out of my nose, and it was a whole body kind of weeping and shaking. And when I came out the other side of that, I felt deeply connected to my body in a way that I'd never experienced before. And I felt a deep sense of love and connection to the rest of the world and to humanity. And this is something that is very common in psychedelics as well, as this deep feeling of connection. So I no longer felt alone. And what this experience taught me was a really profound lesson for me in the mind-body connection. And this is something that we don't do very well in modern medicine. We say that if you've had childhood trauma, you go and talk to a psychiatrist. If you've got physical problems, you go and talk to some other kind of doctor. But what I really learned from that experience was the deep connection between mind and body, and that my anxiety and my ruminations and my difficult thoughts were actually coming out as real physical symptoms. And that may sound very obvious, but it was having experienced it. This was very this became very real to me. If I had gone to see my GP with palpitations due to anxiety, I probably would have been given a beta blocker to make the palpitations go away, and might have been advised perhaps to see a counsellor. But this was really about releasing these emotions from the body. And what I learned also from that experience is that trauma lives in the body. And this again is something that we're not very good at. I don't believe in medicine. We've very much separated the psychology and you know, the role of the psychotherapist from everything else. But what I saw over and over again, where other people in the ceremony were really having this experience of trauma coming out with various aches, pains, physical symptoms, physical manifestations. So this was a very powerful lesson for me, and I'll come back to that a little bit later. And I also learned about the importance of releasing emotions, and this can be done through tears, through shaking, or through vocalizing. And again, I experienced this a lot in the ceremonies, was to see people using different ways to release tension, natural ways to release tension from the body. And I think in our culture we often suppress tears, we often suppress shaking, we often suppress these natural healing mechanisms that the body has to discharge distress. So that was that ceremony. And then the next ceremony, of course, I wanted to know, well, why am I like this? You know, suddenly my life made a lot more sense. I understood where these physical symptoms were coming from, but I didn't really understand why. And so the next ceremony, I went into my birth experience. So this was an incredibly powerful experience for me. Because I'd looked back at my life and thought, well, my childhood was okay. I mean, you know, I don't understand why I am the way I am. And this is a key thing that psychedelics do that is difficult to get from other modalities, is that it uncovers suppressed memories, and it uncovers what we call implicit memory and brings it to conscious awareness. So the hippocampus, which is the area for learning and memory in the brain, doesn't develop until we're about 3.5 or 4 years old. So we're all very familiar with having conscious recall memory from the age of about 3.5 or 4, but after that we don't remember anything. But of course we do, because there's the limbic brain, which is the emotional part of the brain, and there's the reptilian brain, which is the instinctive fight or flight response part of the brain. And these parts of the brain are very much online from intrautero onwards. So we have a body memory and an emotional memory before the age of 4 or thereabouts. So what I lived through was my birth experience. And actually, I knew very little about my birth until I was in medical school in a lecture, and the lecturer asked us, it was an obstetrics lecture, and the lecturer asked us how were we born. And I remember thinking, I think it was a C-section, but I'm not sure. So that's about as much as I knew about my birth. And I relived my birth through a ceremony, and I was in obstructed labour. So I lived this experience, and I went to talk to my mum afterwards, and it pretty much matches up to what she told me after the ceremony. So I was in obstructed labour. I was stuck in the birth canal for a very long time, and then I required an emergency cesarean section. My life and my mother's life were under threat, and it was actually a general anaesthetic, so my mum was completely unconscious. I was born by cesarean, and then I was separated from my mum for the first week of my life, because that's how things were done in 1970s in the west of Ireland, where I was born, and we were just joined for feeding. So I experienced in the ceremony a feeling of my head being in a vice, of my head being completely stuck, of a lot of mucus coming out of my mouth, of a feeling of complete terror. And then I had a feeling of being very exposed and very sensitive all over my whole body, exposed to bright lights and sounds, which was the emotional memory of me coming out via the cesarean section. And then I experienced being very alone in the world, and very crying out for help and nobody coming, of having a lot of this fear and not understanding what was going on and nobody being there for me. And after I went through this experience, I then actually had the experience of going back into the womb, where I felt very, very safe, where I felt full of love and full of compassion and very connected to my mum, and where I was able to look at my childhood from a very different way, and a very deep understanding that my parents did their absolute best, and that these experiences had shaped me. So what this gave me was, it actually helped me to see my life in a completely different way. Suddenly I totally understood why I had a lot of fear, why I had great difficulties in asking for help, because from very early infancy, when I cried out for help, no help came. Why I had difficulties in asserting my own agency, because as I was being pushed down the birth canal, nothing was happening and it was taken out of my hands. And it really allowed me to see my life in a completely different way, and I got completely new insights and understanding. And again, this was a very, very common theme that I saw during the retreats, was that people were unearthing and uncovering very, very intrautero even experiences onwards, and using these to really heal from difficulties that they'd had in their lives, and to really explain what was going on. And on the kind of the, and another example I wanted to give was someone else who I spoke to on the retreat, who had actually been to Peru 7 years previously, and he had suffered lifelong from depression, and he'd always felt that he had to, depression is pressing our emotions down, and you know, he had always felt that he had had to really depress his own feelings and emotions. And through a psychedelic experience, he experienced being a very, very young infant, and his father physically abusing and hitting his mother, and he experienced that happening, and his whole body tensing up, curling inwards, as he would have done as a very young infant. And he understood in that moment that it wasn't his fault that this was going on around him, but that he had really had to hide himself and his own emotions in order to survive this experience. And he said, having suffered lifelong depression, he never had depression again after that. And I think that's quite almost an extreme example, because a lot of people do go on then to, you know, that there maybe their depression recurs, but it does happen that severe mental health difficulties can actually just melt away with psychedelics. And it's because of this deep insight into our very, very early experiences that we can't access through the conscious mind. And this explained to me also a lot about why a lot of my heroin using patients only got so far with counselling. They felt that really they couldn't explain what had happened to them, or that verbalizing it really just reinforced the old story. And what psychedelics does is give us a window into where this old story actually came from. So the last ceremony I want to talk about is one that was also very powerful for me, because it helped me to understand where my fear and where what I would describe as my disconnection came from. So I'd always felt quite disconnected from my emotions, and I used alcohol a fair bit actually to cope with my anxiety and to help me in social situations. And I think this is something that's very normalized in Northern Ireland, and certainly when I went to medical school it was also very normalized. Medical students tended to party quite hard and drink quite heavily. So again, I had minimized my experience by really saying that, well, I'm a bit of a worrier and I like a drink, but sure, who doesn't? Whereas actually there was something much deeper going on. And in this ceremony, I experienced the Shipibo healers who come around and they sing these beautiful ikaros, which are these beautiful songs, and they use these songs for healing. And one of the healers sat in front of me, and my intention during that ceremony was to show me fear, show me my fear. And this Icaros came out of the darkness as a psychedelic pattern of different colors, and I experienced it coming into my heart, peeling the fear away from my heart, as if peeling an orange, peeling the skin off an orange. And my fear sat beside me, and I was able to have a conversation with my fear for the rest of the evening. And this sounds like a very bizarre experience. I mean, it was, but what this really showed me was about parts work. And I'm sure a lot of you are familiar with Richard Schwartz and the internal family systems parts work. But this was, again, something that psychedelics can do so powerfully, is it brings something that we are aware of consciously and intellectually. So I was aware intellectually about this idea of disidentification from difficult feelings and emotions so that they don't overwhelm us. So rather than saying, I am afraid, we talk about I have fear inside me. And that's a way to really distance ourselves a little bit from the fear and make that more manageable. And of course, you know, the parts work is about, you know, I have this part that is very fearful, and that, how has that come about? That's come about from my early childhood, and how do I actually interact with that part? But what psychedelics was able to do was really bring this to life in a very much 3D way, so that I was able to have a conversation with my fear, and I was able to understand that my disconnection from my emotions had been a survival mechanism. There was nobody there to hold me and to contain my emotional experience. So I had disconnected as a survival mechanism. So prior to taking psychedelics, I had understood that I felt a bit disconnected from myself, and I would feel quite angry with myself and give myself quite a hard time. Oh God, here we go again. Why can I not connect with myself? Why can I not express myself in the way that I want to? But what psychedelics allowed me to do was to look almost from the outside at this default mode network. So my default mode network was I'm disconnected, I am alone, I am afraid. And that was, the default mode network is really the pattern or the unconscious story that runs our life. And what psychedelics let me do was really remove myself out, literally out of that default mode network, to look in at it and see with new eyes how that default mode network had been created. I like to call the default mode network the old story, how that old story had been created, and actually to see that story with a lot of love, because that disconnection was how I survived that very early experience. So rather than giving myself a hard time about it, I was able to actually sit with it and show it a lot of love and compassion and say, thank you. Thank you for having helped me survive. Thank you for getting me this far. But actually, I am now able to step into my new story. And what psychedelics allowed me to do was to really experience in a very embodied way a very deep connection with myself. And this is really the ski tracks that James showed in his presentation. Was I was able to come out of those old ski tracks and to create new tracks for myself, at least to have a little window into these new tracks that actually I can connect with myself, I can express myself, I can show my emotions, and that this old story, this default mode network is not who I am, and it's something that I can change. And actually this was something that I saw over and over again in the ceremonies, where old stories being revealed, and the story behind how that old story came about. And that was very, very liberating for people. And people were really able to, and including myself, were really able to break out of these old default mode networks and create something else. So that was my experiences. I've had a number of other experiences on psychedelics, but they were really the most powerful for me. And as a result, I have changed personally, completely, I feel. I now I'm able to access my emotions. I now cry on a regular basis and find that really helpful, and find it a way to really discharge some of my stress. And I have become much more creative, and this is something that I've noticed with people after psychedelic experiences, is that they're able to tap in to their own innate sort of natural creativity that we all have. I've started singing and playing guitar, which is something that I haven't done since childhood, which is something that I love. And suddenly, having had this idea and this sort of old story of I am alone in the world, having gone in and seen where that came from in my life, and being able to heal that, suddenly lots of groups started to appear in my life from nowhere. So I'm now in a wild swimming group where I go cold water swimming every week, and I'm in a music group where I play music with other people. I'm now in the PHP network, where I'm working with others, you know, to learn more about psychedelics and hopefully to facilitate some retreats of our own. I don't drink alcohol at all anymore. It's not something that interests me. I sleep through the night. I no longer have palpitations, and I no longer experience anxiety really at all. So this has been, you know, a hugely transformative and wonderful experience for me. And what I wanted to talk about in a little bit more detail was how, because this is something that greatly interests me, is how this has actually changed my own practice as a GP. So what I talked about right at the start was when I sat in the ceremony with this deep feeling of nausea in my chest, was my understanding of the mind-body connection. And this is something that we actually do very poorly in medicine, in my opinion. We have got conditions such as fibromyalgia and chronic fatigue and dysfunctional dyspepsia and chronic pain, and the list goes on and on and on. And every specialty has at least a bunch of conditions which we call medically unexplained symptoms, and we scratch our heads and we wonder, we can't possibly explain this, this is a total mystery. And of course it's not a total mystery at all. These are unprocessed emotions, and usually deriving from childhood. And this is, you know, there's a lot of science now to support this. There's the PNI network, which is the psychoneurological immunological system, which is the system in the body that really connects the brain with our endocrine system and our immunological system, and explains how emotional processes manifest in the body as physical symptoms. So I used to, I think in common with a lot of doctors, I am slightly ashamed to say, I used to have a bit of a heart sink and a bit of a, oh God, what do I do with this patient when somebody came in with medical unexplained symptoms? And now I actually have great joy in working with these patients, because I now feel that I understand what's going on with them. And I wanted to give an example of a patient of mine that I saw last week. We'll call him Neil. He's a 25-year-old. He's got high levels of childhood adversity, has been through the care system, has been sexually abused. And you know, he has an ACE score, if you think in those terms, of 8 out of 10. And he had been coming back and forward to the GP for 5 years with gastrointestinal symptoms. He had abdominal pain, vomiting, weight loss. He had been back and forward to hospital doctors and dietitians. He had had endoscopies and biopsies and manometries and all sorts of physical tests, all of which showed that nothing could be found that was wrong with him. And because I knew this patient well, I was able to sit with him, and I was able to reflect back to him the childhood adversity that he had experienced. I was able to explain to him the mind-body connection, particularly the brain-gut connection. There's a lot of evidence now that the gut is intimately connected with our emotions and with our brain, and we only have to think about getting butterflies in our tummy when we feel nervous to know how intimately the gut is connected with emotions. And I was able to explain this to him from a place of actually having experienced it myself. And he started to cry, he got upset, and then he settled. And at the end of the consultation, because he'd actually come to see me to ask for more tests, doctor, I want more tests. Nobody can tell me what's wrong with me. I want you to send me for another endoscopy. And at the end of that consultation, he said to me, I don't need any more tests, do I? And I said, no, you don't. And that was hugely transformative for him. And that was the beginning of him moving on a journey of my GI symptoms are related to my past experiences in my life. And this has happened with me over and over and over again. Patients with fibromyalgia, chronic fatigue, chronic pain, when I can go into the emotional experience and to the early childhood experience, people have enormous shifts and changes and are able to progress towards healing. So the second thing I learned, of course, from the Shipibo was that symptoms are teachers. And what the Shipibo say is that if somebody, well, a couple of interesting things they say. One is that they say that all the Westerners who come to the jungle to experience ayahuasca, they see us all as having end-stage heart failure emotionally. So they see us as being in a very poor emotional state because of our Western lifestyles, because we lack connection to nature and to each other, and because we work far too hard and we're socially isolated and all sorts of things. But what they say is if somebody is having some kind of nervous breakdown, they say good. this is what needs to happen. There was something in your life that wasn't serving you. There was something that wasn't working. You've broken down. This is where the healing can begin. In contrast to Western medicine, where if somebody is having a breakdown, we kind of go, oh God, that's terrible, and immediately try to fix it. So I would invite you to think about symptoms that you have had in your life, and it might be something as simple as twisting an ankle. You know, what does that tell you? Were you maybe not being totally present with your body? Were you distracted and you stumbled over a pavement? Were you not listening to your body? Or, for example, when I burnt my mouth in some hot coffee 2 weeks ago, I was in a rush and my body's telling me to slow down. So it's a really interesting way to look differently at symptoms. So my palpitations were telling me that I had emotions in my body that I needed to work through. So this is symptoms as data, not as problems. And this is very different from how we approach this in the Western medicine. The next thing it taught me was that we are all affected by trauma. And this is huge. So all of us, now I don't have any what we call big T trauma or any ACEs, but what I had, trauma is what happens inside the body. And trauma is not necessarily an event that has happened that's distressing in our life. It can be the absence of something that wasn't there that should have been there. And what we all need as human beings in order to develop fully is we need a non-stressed, present, emotionally attuned adult from early infancy onwards. And in those very early days, I didn't have that. So there was something that was missing that should have been there. So we are all on a spectrum of trauma, I believe. We cannot exist in this modern world without having some level of trauma. And as a doctor, to approach patients as things that are broken that need to be fixed, I don't believe that there is much healing that can come from that place. But what my own experience taught me, and what psychedelics have shown me, is that we all have some degree of trauma, and that as a helper, as most of us on this call are, as a helper, what we are there to do is to guide and to facilitate someone else's healing, but that we cannot do that unless we've done that for ourselves. And we can only bring somebody as far as we have gone on our own journey. It's a bit like being a driving instructor teaching someone to drive and not actually being able to drive ourselves. It doesn't really make any sense. So I have learned from my own healing that I can guide others on this journey from the position of being an equal. And actually, when I sit in front of one of my patients who's addicted to heroin, I don't see any difference between us. The difference I see actually is the level of trauma that they've had. So their coping mechanism is a lot more drastic. They inject heroin, but that's because their trauma is a lot more severe. My coping mechanism was drinking alcohol, but then my trauma was a lot less than theirs. So the next thing I learned from the healers was self-care and self-love. And this was something that was really interesting, because when the Shipibo welcomed this group of quite high-level doctors, psychiatrists and psychologists to the jungle, they were looking forward to working with this group of people who they assumed would be much more healthy than the Westerners that they were used to looking after, because they said, well, these are the healers for their community, so they must have done a lot of their own work, their own personal work and development and self-care. And the Shipibo healers take their own self-care extremely seriously. They go through a whole process both before and after ceremonies of taking care of themselves. And they've done a lot of personal work out in the jungle, dieting on specific plants from the age of early adolescence. So they're extremely centered in themselves. And they talked about susto, which is the Spanish word for trauma. And it was reported from the team, we didn't have direct interaction outside of the ceremonies with the healers, but it was reported in the team that during the lunch breaks and during meals, the healers were to be found sitting in a circle, holding their head in their hands, going, mucho susto, mucho susto, and how they couldn't understand how we took care of ourselves so poorly and how we had such high levels of trauma. Now, I believe that as health workers, we actually have higher levels of trauma than the general population, because that's what brought us into the healing and the helping in the first place. But when we went around the group and talked about this, everybody was very honestly able to say that they had no self-care and things that they did when they came home from work, from dealing with quite heavy duty, trauma and addictions and everything within the population they were working with. And I didn't either. So I would invite you just to think about what you do when you come home from work. Do you reach for a cup of coffee or a glass of wine, or do you just jump into cooking the dinner or looking after the kids or whatever it is? because I have now changed that. And when I come home from work, I have a 5 minute, at least, sometimes it's half an hour, sometimes it's just 5 minutes, something that I do, whether that's deep breathing, whether it's dancing energetically to my favorite tunes, whether it's lying flat on the floor, or whether it's doing a bit of yoga. I do something to check into my body and to ask myself, how was that for me today? Am I carrying anything from any of the patients that I've seen? So this is extraordinarily important, and it's something that we're extremely bad at, I believe, in the helping professions in the West. So a couple more things that I've learned. One was to be much more present. So what I've found is that when we deal with our own difficulties, we're much more able to be very present with patients and clients. We don't get triggered by them. And there were patients that came in, especially those, as I've said, with medically unexplained symptoms, that I would feel like, oh God, what do I do with this person? That's gone for me now. So I'm really able to be extremely present with somebody and really see what is going on for them. And a final example I have is a patient who came to see me with very, very bad eczema. She'd been back and forward to the doctor numerous times. She was on heavy duty steroid cream, and her skin was bright red and scratched and bleeding in places. And she came in and she was furious. She was angry that we hadn't been able to help her. And in that moment, rather than thinking, oh God, what am I going to do with this patient? I was able to really look at her and say, you seem really angry. And she said, I am. And all this stuff came out about anger at us in the medical profession, but also about her mother and about her mother's alcohol use and all sorts of stuff about her childhood. And we had this really interesting consultation. And I said to her, do you think your skin looks angry? Because to me, it really did look angry, literally. And we know that skin, particularly because of its origins, that it comes from the same tissue as the brain tissue, that skin is a very intimate connection with stress. And she went away and she came back 2 weeks later and her skin was much improved, and she'd really taken on board what I'd said about anger and she'd started to deal with it. So again, this was the mind-body connection. This was me being present with the patient and me having had my own experience through psychedelics of being able to connect with this mind-body that I could see in her, that she needed to really think about her anger. Crying as an intervention. So I always did have a box of tissues on my desk, but I now view tissues as equally as important as my stethoscope and my prescription pad. And patients come in and they often ask for, doctor, I want antidepressants, I want sedatives, I want sleeping tablets. And I can see that they're very emotional, and I'll sit down and I'll say, yeah, so just tell me. And the presence of just saying, what's going on for you? How are you feeling? The tears well up. I say, tears are really welcome here. I'm very comfortable with crying. I don't try to shut it down. And nine times out of 10, the patient leaves without any tablets. They come back in 2 weeks and they go, thank you very much. And it's the crying in front of someone, and someone who doesn't believe it's shameful, because in our culture it's shameful. And me sitting going, this is great actually that you're crying. This is great. This is an emotional release. This is what you need. This is the body's natural healing mechanism. You know, go for it, cry some more. And that is really transformative for people. And the final thing I wanted to talk about was mistakes. We all make mistakes. Doctors make mistakes that can lead to harm and can even lead to deaths of patients. And it's something that in the medical profession, we tend to say, let's just get on with it. We do have a system for looking at mistakes, but not for the emotional impact the mistakes have on us. And I've learned to really sit with that emotion, to work through it, and to really feel it. And I believe that that has helped me learn a lot more from my mistakes, and has helped me not to do what doctors do, which is just get on with it, but really to sit with the emotion and experience that. So in conclusion, I want to say that psychedelics are one modality that I especially have found very helpful, one amongst a huge number of modalities. That what they do particularly is they give us embodied experiences, not just an intellectual understanding, but an absolute body experience. Somebody's mentioning Waking the Tiger. Peter Levine talks a lot about implicit and explicit memory. So if you read Peter Levine's work, psychedelics is our immediate access into implicit memory. So it allows us to experience these very early experiences that have formed us. It allows us to have complete ego dissolution, to connect very deeply with the world around us, to feel a deep sense of connection and a spiritual connection even. It allows us to have new insights and understandings into our default mode network, how those networks came about, and it liberates us from those networks. And it allows us to look at our own trauma. And I believe that true trauma-informed practice is having dealt with our own stuff, not completely, because it's always a work in progress, but at least having looked at our own stuff, looked at our own difficulties, and really dived into those in a deep way so that we can then guide others to do the same. So that's all I wanted to say. Thank you very much.
Oh, thank you so much, Aisling. I could tell by all the little boxes, everybody was absolutely riveted to your story. And I really appreciate you just sharing that so honestly with us and in so much detail. And it's just really amazing, I think, how doing your own work, how you, from where you began and how you traveled through that and how it's actually come out the other side and is really affecting your own practice in a really positive way. So it's so encouraging and so amazing to hear that. I think you told us at the beginning there you're moving back to Belfast, back to Northern Ireland. So there's lots of people asking where are you going to work? Can they come to you as their GP? So you might have a queue.
Great, absolutely.
So let's see. So if anybody has questions, we've got about 15 minutes for questions or comments. Please type them in and I'll read them out. Let's see. Yeah, somebody wanting to know where you're going to work in NI. Where are you going to be working, Aisling? You can tell us.
Well, I'm not sure yet. It's an interesting question. I'm going to start off doing a bit of out of hours work just to pay the bills. But what I found when I came back from the jungle was the medical model of seeing people in 10 minutes and managing symptoms and kind of pretending that symptoms, or not pretending, but not recognizing that symptoms have anything to do with early childhood or emotional experience in the world, I find very, very difficult, actually. I find it more and more difficult to be a GP, and I changed to the homeless practice partly because of my interest in addictions, and we know that homelessness usually has its roots in childhood trauma and goes along with addictions. And in the homeless service, we get a lot longer with the patients, so I've really enjoyed that. But what I have found, what I would say about the medical model is that it works extremely well in very acute situations. So for my mother's emergency cesarean section, for example, or my father who's had a kidney transplant, this is when the medical model shines. And I have a lot of respect for the model in those situations. But for chronic disease and for addictions, the medical model just does not work. That is my view. And we have to be, and we need to open ourselves actually as a medical profession to really understand this mind-body connection and to really start using other modalities, not just trying to make symptoms go away. And actually, what happens when we try to make symptoms go away, for example, with chronic pain, is what's happening in America with the opioid epidemic. So we know that this doesn't work. So I am searching for a GP practice that is willing or is open to doing things in a slightly different way. And I haven't found it yet, and I am thinking about setting up my own practice. And what I would like to do is set up a GP practice that's actually embedded within the third sector, so that we're not saying that health and wholeness and healing is about being referred to hospital or taking lots of medications, but rather is about body work, is about mind-body connection, is about using modalities such as yoga and meditation and these things that connect us to our bodies, and really looking at our emotional health and looking at this in a much more holistic way, looking at parts, doing internal family systems and all of this kind of thing. So maybe I'll set up my own practice. I don't know.
Well, I think you'll have a lot of support if you do, especially with our group here, because there's some people saying, Stephanie here is saying it all makes a lot of sense. She has read The Body Holds the Score, and which is Bessel van der Kolk, and Waking the Tiger. exploring trauma all links up so well. Kathy is saying, I can relate to everything you have said. I have for years worked with different modalities. Thank you for being so honest, Aisling. Melanie said, what an inspirational story. Thanks for sharing with us. And Maggie is saying, brilliant. Thank you for sharing your own experience. I am up for a retreat when you get it running. Great, Maggie.
Great.
Thank you, Aisling. It's an amazing story. I'm just seeing if there's any more questions here. Okay, here we go. Here's a question from Julianne. What was the name of the tribe you did the ritual with, and how did you spell it?
Shipibo, which is Shipibo. The Temple of the Way of Light is the center in Peru. It's got a very good reputation. There's a lot of different ayahuasca healing centers in Peru, some of which are better than others, but this would be one of the very, very good ones. And they've got a really good website, and you can go on and actually see, for example, Gabor Mate talk about his experience. And I've learned a lot from the traditional healers, and it's something, it's something that's quite interesting in that I don't want to kind of romanticize it either. Someone told me about how the healers had said to them, Western medicine's amazing, you take a little white tablet and it fixes everything. So they're kind of, think that we've got this wonderful system that is kind of a bit magic. And we as doctors and clinicians in the West, certainly I do think that they have got this wonderful system that's a little bit magic. So I think it's not about using one system or the other. It's about knowing how to combine them appropriately. So I feel that the Western medical model, as I've said, is really excellent at acute care and at surgery and these kind of things, more on the acute end of the spectrum. And I think the Shipibo style way of doing things is much more appropriate on the more chronic, long-term end of the spectrum. So it's about using the best of both, I think. Yeah.
Great, thank you. I have a question here from Kate Acton, and she's saying, hiya, Kate. That was great, Aisling. Thank you. It was so open and touching, especially the importance of the birth experience. I find it hard to get clients remembering and understanding the importance of their first conscious experience. It would be great to get more information and experience around unpacking those younger experiences.
Yes, thank you so much. Hi, Kate. Thank you for your question. Yes, I feel that this is something that it actually comes up in, psychedelic experiences again and again. It's very, very common for people to go back to their birth. And if we think about it, the most important thing that has happened so far in all of our lives is the fact that we've been born, and we don't actually give a lot of credit or a lot of focus on how we've come into the world, and it is extraordinarily important. And I certainly know amongst obstetricians and pediatricians that there doesn't seem to be really any awareness of birth experiences or birth trauma, and I've seen this over and over again. It's something that I speak to patients a lot. I actually ask them a lot more, how were you born? And I think it's also a misunderstanding of, even amongst doctors, of this idea of implicit and explicit memory, and that recall memory is the only memory that counts, that anything from the age of 4 onwards is significant, and that because we can't remember what happened before the age of 4, or we can't recall, should I say, what happened before the age of 4, that it somehow isn't significant. And we know absolutely that isn't the case. And we know from lots of studies, actually, for example, of pregnant women who are under stress, that the children in utero then go on as adolescents to have higher levels of DNA methylation, for example, that their genes are expressed differently, that they have higher rates of mental health problems. So we know that there is a direct correlation with difficulties later in life with, stress in the mother, even when the child is in the womb. So I think this is something that is, I don't think it's impossible to kind of unpack these very, very early experiences without the use of psychedelics. There are definitely other ways to do it, but psychedelics is a very powerful way, because what happens is you actually relive it. It's like you have the emotional memory in your body, and then you're able to fit a story or a picture around that actual emotional memory and relive that experience. So yes, it's extremely powerful, and it certainly helped me to really experience and to see how extraordinarily important the, you know, from in the womb to age of 3 is in our experiences as adults, and that these very, very, very early experiences are hugely formative. Yeah.
Okay, thanks for that, Aisling. There's a few people asking about the retreats, and James did mention about the Psychedelic Health Professionals Network and the retreats that will have been postponed due to coronavirus. But maybe you could just explain a little bit about, you know, because somebody's asking, do you have to be a practitioner to go on a retreat? And somebody else is asking, do we have any practitioners in NI who work with psychedelics? So maybe you could just say a little bit about the PHP retreats in Holland.
Yeah, James, I don't know if this is something that you want to come in on as well.
I mean, why don't you go ahead and I'll chip in.
Yeah. So so the retreats we wanted to offer as experiential retreats, open to anyone who's interested. And my particular interest actually is because, you know, psychedelics have had such a powerful impact on my own work, is to offer retreats to health professionals. But actually the PHP retreats are for anyone. And the idea is that, you know, we really follow the evidence on what works and what doesn't of what we know so far. And also that we really put a very strong emphasis on set and setting. So what James talked about with, you know, headphones, eye mask, setting an intention, being in a very supportive group environment, all of that stuff. But plus that we would put an emphasis on formulating an intention of what you want to look at before you go on the retreat, and then having support afterwards to help to integrate the experience and to help to guide you on how to bring this into your life. So that's the idea. We were planning to start running them this year, but obviously coronavirus has sort of thrown that off a bit. So we would hope to have them running next year. The details are going to be on the website. And yeah, I feel it is especially complementary to people who work as psychologists and psychiatrists and helpers. But yeah, the retreats are open to anyone. And as far as I know, there's not anyone doing any kind of psychedelic work in Northern Ireland that I know of.
So can I chip in?
Sure, please do. Yeah.
With treatment, say for treatment-resistant depression or post-traumatic stress disorder, or the research studies routinely have used 2 therapists for each client. With the retreats, we're going to be looking at 1 facilitator for 4. So we're going to have 4 facilitators and 16, up to 16 on the retreat. And we will be screening, actually, because I don't think it's fair to have people coming along who are going to need lots and lots of support. I think, you know, I work with people who go to the Netherlands, and I would help them orientate and keep in touch with them in the Netherlands while they have a couple of trip sitters or a trip sitter, and help them orientate afterwards. And there are some people who I do that with who I wouldn't be happy to have on a retreat of 1 person, 1 facilitator for 4. So I think there is some screening, actually. But yes, it's certainly an option.
Yeah, sure. Sorry, James. Yeah, open to everyone who wants to apply. But yeah, there would definitely be a screening process, you know, to look at what medications you're on, and, you know, if you have a history of psychosis, for example, or you know, whatever, to as James has said, so that everyone who goes is safe to go. Yeah.
And in terms just of within Northern Ireland, I'm sure there's lots of reports of stuff going on in the background in the sort of but it's just good to remember that psychedelics are not currently legal, apart from the ketamine through, you know, and I don't think it's been used in Northern Ireland. So, but I think there's definitely reports of this kind of thing going on underground, so to speak. And of course, there are issues around that in terms of safety, in terms of who the practitioners are, the set and the setting, how it's integrated. So it's much preferable to have this done in a legal setting, where you have all those safeguards in place. Let me see if there's any more questions here. Joanne is just making a comment. I have found the use of psychedelics very complementary to my practice as a counsellor. I work from a person-centred modality, focusing on the mind-gut connection through mindfulness and vagal nerve toning practices, in particular breathwork and meditation. I am attending a Bufo retreat soon, which I'm greatly looking forward to connecting deeply with myself. So that's all the type of things, all the different modalities you were talking about, Aisling, and how all of these have a place, and they all sort of work together in this healing journey.
Maybe I just chip in for a moment and say, I've worked with, who is going to be helpful supporting a psychedelic trip, I think is really interesting. So I've worked with 4 or 5 expert facilitators of psychedelic trips. I think the most experienced and the most qualified was the least use. So it's just very intriguing going, so what qualities make for good facilitators? I think there's a lot of overlap with what makes a really good therapist, actually. And I think that's something that we're still exploring with fascination. Mm-hmm. So just toss that in.
And just one, I've got a final question here from Ed, who's saying that we work in medically governed systems within mental health, led by consultant psychiatrists. And there was a time here in Northern Ireland that opiate substitute prescribing was not used at all, although that was 25 years ago. So are we looking to influence a cultural change?
Yes. Yes. We are looking to pull psychiatry out of the dark ages, I think, is what we're looking to do. Yeah, my view is that this notion that that you have depression as if it's some kind of disease that you acquire like an infection, and that it can then be medicated, and that it's nothing to do with your environment or your early childhood experiences or whatever, which is the model that psychiatry still uses. And I'm not saying that SSRIs aren't helpful. I do occasionally prescribe them. I think that they can be very helpful in the short term. They have a place, but I think that we hugely overuse them. I think we hugely, certainly in the homeless service, overuse antipsychotics. I think antipsychotics are helpful, or can be very helpful for in the short term for people who experience very distressing voices, for example. But we overuse them way beyond that as a sedative, just to really stop people feeling distressed. So I think the drugs that we have available in psychiatry are very, very crude, and they're not particularly effective, and they're certainly not about healing. And I find that the labels that we use in psychiatry, again, labels can be helpful, but they're not very empowering, and they don't really explain what's going on. And there's a wonderful psychiatrist called Judith Herman who wrote a book in the 80s in America, and she said there's one psychiatric diagnosis, and that's childhood trauma. And that would be really my view as well. So this is a big shift. It's like the ACEs work. It's a big shift. There's nothing wrong with you. It's about what's happened to you. You're not broken. You have the capacity to heal. We're here to guide you. We're not here to fix you. This is a cultural shift. Massive cultural shift. So I'm not sure, I haven't met all that many psychiatrists that are on board. It tends to be, there were a few doctors at the retreat in Peru. It was mostly psychologists and things like coaches, and there were a few body workers. So the medical profession is, in my view, still sort of to come on board with this. But doctors like evidence, and there is mounting evidence, and I believe that it's going to be difficult for psychiatrists to deny psychedelic therapy to people as the evidence builds. I mean, it's still, it's still a work in progress, but as the evidence builds, it's going to be harder and harder to, for example, put somebody through the traditional alcohol program that really isn't that successful when you have now MDMA with Bensessa, which looks like it's much more successful. So there's something about denying treatment then.
Maybe worth just commenting with Bensessa that he was using his MDMA intervention along with the program that was available in Bristol for people with those problems.
Yeah, sure. So it's alongside, and I think this is also a shift in the model as well, is that this is not a pharmaceutical. This isn't something that you take in a retreat or a ceremony and then you walk away and that's it and you're fixed. I mean, from my point of view, with me experiencing this mind-body connection, I then had to go away. I found a good body worker. I did a lot of body work with her. I had a lot of releases through that. I did a lot of yoga. I took up a meditation practice. I had a coach. I coached with somebody for about 2.5 years. He was quite a therapeutic coach, so I essentially had a therapist. I've done some breath work. I journal every day. I changed my diet. I exercise. I do cold water swimming. I mean, the list goes on and on. So this is not, it's like psychedelics were the key that gave me a little window into what was possible, what I was aiming for, and was like a signpost that led me to things that I found very useful in my life that have really helped me. But this is definitely not like you take a pharmaceutical drug and then you're cured. It's definitely not like that. So again, this is a big shift in the model as well. So I think that's part of what is very exciting for me, because it's not a quick fix. It's slow medicine, and I think we need to get back to, or maybe we never were there, but we need to explore slow medicine. Healing takes time, and it's not something that comes in a tablet.
Great, thank you. So I'm just going to close everything off now. Thank you, first of all, a massive thank you to Dr. James and Dr. Aisling for joining us today and sharing their wisdom, I think is the only word for it, and their experiences. It's been really intriguing and really interesting, so thank you